We have briefly discussed the continuous assessment process in previous modules, but this week we will expand on the process and what is involved in each component. There are several purposes for assessment. Some of these are involved with determining the abilities of individual children, while others focus on groups or entire programs. Assessment is also used to plan instruction as well as to determine programmatic effectiveness. We will discuss each purpose individually. The purpose of screening is to identify potential concerns and to provide intervention when concerns are identified. We begin screening for potential concerns even before a child is born through tests such as amniocentesis. Immediately after a child is born, we screen for PKU, a rare inherited disorder, and for hearing loss. Through these types of screenings, we're able to identify and prevent future developmental problems. Screening instruments must be sensitive enough to identify potential concerns and specific enough that they do not vastly over-identify children as needing intervention. We have mass screenings, such as kindergarten screening, and selective screening, in which individual children are screened based on concerns identified by parents or teachers. A key point in relation to screening is that the information be used to address child and family needs. Another purpose of assessment is diagnostic testing. As discussed in previous modules, diagnostic testing is used to determine eligibility for special education services and typically involves the use of standardized, norm-referenced assessment instruments. A child's performance is measured on the normal curve to determine eligibility for services. Issues associated with the use of standardized testing methods with young children include a lack of appropriate standardized instruments for use with young children and young children's lack of experience in participating in the testing situation, which tends to create test results which are not valid. A variety of information is needed to develop individualized plans. The intervention needs to be general enough to address all of the needs of the child, not just those tasks and activities that they will complete when in our presence. We need to look at every aspect of a child's life to ensure they are able to access the environment at all times to the best of their ability. We gather information about the child through observation of the child or through interviews with family members or others who are familiar with the child. We also study the environments in which the child spends time. We need to know where and how the child spends her time so that we can address needs related to independence in each setting. Finally, we need to know what the family wants for their child and what they think is needed in order for their child to be independent and engaged. In addition to developing individualized plans, assessment information may also be used to determine group needs within a classroom. For example, after teaching a particular skill or addressing a particular standard, teachers need to know whether the child in the group have mastered the information, and if not, what needs to be done to further address the group's needs. Monitoring children's learning regularly and frequently over time is an essential feature of high-quality services. It's important to note that children whose teachers monitor progress regularly and frequently have higher rates of learning compared to children whose teachers do not. Assessment information is also used to determine program effectiveness. If we're all familiar with the term accountability. Governments or agencies that provide funding to programs want to ensure their programs are effective. Although program accountability is an important issue, it is equally important that appropriate methods be used to ensure accountability. Program impact and social benchmarking are also components of program effectiveness. It is important to know whether programs are making a difference in child outcomes, both in terms of performance and overall well-being. Assessment is used for multiple purposes, all of which are important for various reasons. As discussed in previous modules, it is extremely important that the assessment methods and materials are used in appropriate ways and for valid reasons.